so thank you so much for coming today to our interviewing techniques workshop. It is being recorded, so if you do need to leave or have something come up, feel free to leave, and we will have it posted on our website within probably a week or 10 days. We also have last year's mock MMI interviewing technique workshop also. So I want to take the time to thank you for coming today. This is going to be a jam-packed hour of information. So feel free to ask questions in the chat. We'll have someone monitoring the chat. But before we get started, I would like to have Angelina, our pre-health ambassador, read our land acknowledgement for the University of Arizona.
Okay, I apologize if I read the tribes wrong. I will try my best though. We respectfully acknowledge the University of Arizona is on the land and territories of the indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the and the Yaqui, committed to diversity and inclusion. The university strives to build sustainable relationships with sovereign Native nations and indigenous communities through education offerings, partnerships, and community service.
Thank you for doing that. So my name is Josephine Jin Morgan. I coordinate the pre-health professions program here at the University of Arizona. I've been working with pre-health students for over 20 years. So this is a wonderful population I love to work with, and interviewing is always a stressful time. So if you're here before you're ready to apply, this is great information. If you're ready to apply, hopefully we'll ease some of your questions. With me today are also our other pre-health advisors, and let me introduce them. Ethan Bull is our probably senior pre-health advisor. And then we have Lauren Mosley. And then we also have Nettie Gupta, who's our brand new pre-health advisor. And so with this team, we're here to assist you and help you with the process. So today we're going to talk about interviewing techniques. And the first part is going to really be focusing on just general interviewing. And then the second part, we're going to dive into a mock MMI. And so you might want to look at our previous recording because it covers a mock interview with other types of interviews. But today we're just going to do 3 stations, mock MMI for the mini multiple interview. So we're going to go ahead and get started right now because there's a lot of information. All right, as I mentioned, the pre-health ambassador, it's actually, this program is for pre-health ambassadors workshop series. So our ambassadors, we have 11 pre-health ambassadors that work with us and work with our office to do outreach and recruitment. And so part of their duties is to really coordinate with the pre-health advising office to set up a series of workshops. Our next one will be on Mcat Resources. So if you're an applicant that's going to be ready to apply for this year and you're wanting to take the MCAT to prepare to get in for 2023, you're at the right place. We have a series of workshops that we'll be covering. So here we go. You know, if you're an applicant right now, you submitted your application probably last year at this time, getting things all ready, and you've got notice that you received an interview. Probably the biggest thing that I would like to share with you is that if you get an interview, you have a shot at getting in. And I can't emphasize that enough because I think the process is so meticulous and overwhelming at times that you think, I just want to get in, I just want to get in. But let me tell you, when we look at the numbers, our College of Medicine Tucson, you know, generally has about 10,000 applications with 6,000 secondaries. They interview 650 for about a class of 120. So you get an interview, you got a shot at getting in. So that is really important. So when you're interviewing, really you're trying to develop that impression, that first impression. When you walk through that door, you've made it through the screenings, you've made it through the MCAT, you've made it through the secondary applications that you're applying for. And so basically the interviewers are wanting to know, you know, is this consistent with the person who's applying? So part of it before you go in for the interview is to prepare yourself. If you've applied to an average number of schools, 15 or 20 schools, each school has a different mission statement. Each school may have a focus on a different type of class that they want to bring in. So preparation and also reflection about that journey that you've been going through for this past year, and then evaluating where you are. So after the interview is over, you definitely want to make sure that you also get some type of feedback if you can. Some schools will provide that feedback. But when preparing, keep in mind your skills, your qualifications that med schools are seeking for in a candidate that's applying. So the preparation is really to describe yourself and the state as far as your values as a candidate. You know, why do you want to become a physician? I've been part of interviewing committees for many years, and no doubt you're going to get hit with this question. Whether it's being a doctor, a physician assistant, or whether or not it's physical therapy, they want to know why you want to do this. And so you should already have that in your mind, thinking about how you're going to answer this question. And what are your abilities? And these come into play with your clinical experience, your shadowing experience, and then how have you prepared for this process? So part of this is practicing and making sure that you really become very familiar, and you probably have because you've gone through this, your accomplishments, your experiences, your education, the skills that you have gained, and also what are your career goals. So reviewing your written application is definitely a must before you go in for the real thing, for the interview. Know it well, incorporate it with your verbal answers. Practicing is the biggest piece of this. This is not something that you can think about at the last minute or just show up and hope that you answer the questions, because these committees are looking for specific type of individuals that will come in for their incoming class. And one of the best resources you have is a AAMC website. And this is where, when they redid the MCAT in 2015, the other part of reviewing this whole holistic review process was they developed these core competencies. They're telling you already what they're looking for in an applicant. And so you should be matching up your experiences, your academic, your personal experiences with these pre-professional core competencies. Service orientation, your social skills, your cultural competency, your teamwork, oral communication, ethical responsibility to self and others, reliability and dependability, resiliency, and then capacity for improvement. And below, and we'll share this presentation with you, and it will be posted on our website. So you definitely want to make sure you check out the AAMC website, look up these pre-professional core competencies. How do they line up with the things that you've been doing? Every individual has unique experiences, and every one of your journeys is going to be uniquely different. And so you want to bring out the best of what you have experienced and why it reinforces why you want to go into the health professions. So just to give you an overview of the types of interviews that are out there, you have traditional interviews. And years ago, before they did the MMIs, everything was traditional. So you might have had a one-on-one, maybe 3 different interviews, one-on-one, 30 to 45 minutes long with one person. They could be open interviews. That means they have access to your MCAT, your personal statement, all aspects of your application, or it might be a closed application, interview process, where they have no information. And actually our College of Medicine Tucson is closed. So the interviewers that you interact with do not have access to any information. You're coming in cold, they don't know you. So you can't just say, well, according to my application, or picking up on where I left on my application or my personal statement. They don't have that. So you should find out what type of interview that school is having if you've been invited to more than one institution to interview. So check them out, and they're more than willing generally to give you information about their interviewing process. Then you have panel interviews. So you might have 3 faculty members, maybe 2 faculty and a past medical student, and they might be interviewing one person, they might be interviewing 3 people. And there are some schools that do panel interviews. So they might be asking the same question of all the individuals. They might be tag teaming and asking different questions. So that's a panel interview. A hybrid is where they'll do maybe a small mini MMI and maybe 3 stations. And then they might do individual ones also. The University of Michigan has been known to do that. So it's a hybrid type of interview process. And then of course, it's the multiple mini interview, the MMI. And so that's really what we're going to focus on today. If you looked at our previous recording from last year, we covered the traditional, the panel in the previous one. Today, for time purposes, we're only going to focus on the MMI. So again, prepare, do your homework, feel comfortable with your answers. Keep in mind those skills and qualifications that medical schools are seeking in a candidate. Again, I say the core competencies. You should dream those and remember those and link up your experiences with those. Not only just answer the question, but also explain what it is, and also use a narrative and then tie it into a core competency if possible. And sometimes it's even more than one core competency. And then review your application, because you've already thought through this. If you filled out your secondary, your primary application, they've already put you through the thought process on many aspects of what they're going to be asking you maybe in the future in an interview. Definitely know their mission statements. If you've gone through the MSAR, the Medical School Admissions Requirements Guide, on the website, you'll see that each school has their own mission statement. Some of them may sound similar, but some of them may be very different. And so you really want to look at what are they looking for, because that mission statement will give you some insight on what kind of class that school wants to bring in. And so look at that mission statement. Definitely review your secondary. That secondary was vital, because your primary application, many times they automatically send a secondary. But when they invite you for an interview, they've looked at your secondary, it's been reviewed and also evaluated. And so it was strong enough to bring you or invite you in for an interview. So again, you should feel really confident. Don't think about, I just want to get in. Now it is like, where do I see myself? When you go in for that interview, you should be checking out that school also to see, is it a good fit for me? Are they providing the things that I'm looking for in a medical school? Whether it's, residency placement, whether it's the type of teaching that they offer, is it problem-based, is it traditional? What things do they integrate? Do they have joint programs? So again, be the consumer. When you're in the interview, you should also have questions that you ask of the interviewer, and also anytime that you interact with any of the admissions committee. So review your secondary. And I always say connect with students. If you know individuals that have gone to that school and have been accepted, what is their satisfaction with the way the school is run, and how do they deal with issues that happen in the school, and how accessible are they? What things are you looking for? Are you looking for different clubs and organizations? Are you looking for different camaraderies as far as getting involved in different things off campus? So again, be the consumer, check them out also, but connect with students and ask them those questions about how they feel about the school and their satisfaction. So we're going to go into the second part. So the second part of the MMI that we're going to be talking about are the actual mocks. And so we're utilizing our 3 pre-health advisors, and we're using our ambassadors as the applicants that will be interacting with them. At the end of this, then what we're going to do is we will do a question and answer. So if you have any questions about, interviewing or things like that, we'll leave a good portion of the time to talk about, any questions that you might have or anything that I might have missed. So we're going to go ahead and start up with the mock multiple mini interview. And this is a picture of, right now, all the interviews are still done virtually here at the College of Medicine, Tucson. But this is actually a picture of the 8th floor of the Health Sciences Innovation Building before COVID hit. It had just been built, brand new. I think they did maybe 1, maybe 2 rounds of in-person interviews, but this is what it would look like if you were up on the 8th floor. And hopefully, maybe next year, it'll be back in person. So in this part of part 2, we really want to give you more information about what is it going to look like if you are a candidate that's going to be interviewing at the College of Medicine Tucson. So with their permission, we have integrated some of their slides and the information that they're providing, so we can give you the most information about how's it going to be at the College of Medicine Tucson. So they've been around over 50 years. And One thing that's unique about this College of Medicine is that they have distinction tracks. And this is all information that is on their website. They have a community service distinction track, rural health, global health, integrated medicine, medical education, a medical Spanish track, leadership and innovation in healthcare. So if you're interested in any of those are really good areas that you could focus on once being admitted into medical school at the College of Medicine Tucson, that they have these distinction tracks. And why the MMI? So the MMI at the College of Medicine Tucson has actually been around for quite a while. It's been around since 2011, and that's when they first did them. And I know that I was involved in that first set. And so, they worked out the bugs. Originally, a structured MMI, just to give you some background information about this, typically it's 10 stations, and one station is a resting station. The other 9 stations have interviewers in them. And then also what's a little bit different for this year than last year is that typically the type of questions that you might get asked were a traditional question, like, why do you want to be a doctor? A discussion question where you would interact with the interviewer. And then there would be an acting station where there's actually, if you've heard of a pre-MD, the College of Medicine Tucson uses an ambassador program, and they use pre-MDs as actors in that acting station. So there are like 3 different types of interviews that happen. And generally for full-blown MMI, usually it's 10 stations with 9 interviewers and 1 resting station. But again, they're trying to assess your communication skills, your professionalism. So dress, for success when you go in for that interview. Wear something that you're comfortable with, that you haven't just put on that first thing in the morning, but that you're really comfortable, and the shoes that you're wearing, if it's actually an interview where you go onto the campus. So you want to be in a very comfortable attire when you're going through, and professional attire. They're going to ask you about your ethical decision making and really important characteristics of, what does it mean to be a physician? And the research really has shown with these MMIs that it's a great predictor of clinical performance. So, you might be really book smart and very intelligent, but you also have to interact with individuals who are not like you, and you're going to have to develop rapport very quickly with patients. And so it's a good, predictor of how that clinical performance will happen. Scores are not associated with social demographic characteristics. And then it minimizes unconscious bias that may present traditional interviewing scoring system. So as I mentioned before, the MMIs, typically they were traditional interviews. You had 3, they might have been a half hour to 45 minutes long. And either you really connected with the interviewer or sometimes you didn't. And it all depended on one person. With the MMI, the beauty of this is that, if you, and I believe, and we'll go into this, I think it's 6 stations for this year. You have 6 stations to kind of prove yourself. And if you bomb the first one, it's okay, because you can just catch your breath, refocus, and then move on to the next interview. Versus previously, if you didn't connect with your interviewers and it didn't work out, it was really hard to redeem yourself. So that's where the MMI really comes into play, because you're not just betting everything onto 1 or 2 or 3 interviews, but that you have other interviews to kind of balance it all off. So the MMI process, and this is our College of Medicine Tucson. So basically, when you saw that first slide where the people were standing in front of the door, so just imagine this is virtual, so you're going to be in front of your computer. And the way that it works is that the applicant will have 2 minutes to read the prompt. And then you'll have, and this is the actual link for the College of Medicine Tucson. So you have 2 minutes to read the prompt. Let's say, why do you want to be a physician? So those 2 minutes, you're gathering your thoughts, pulling in together your personal experience. How does that integrate with some of the core competencies so that you can have a thoughtful process when you interact with that interviewer, of how you gathered your thoughts and that sort of thing before doing the real interview. Then once you start the interview, It's 7 minutes long. And so that is your time. And if it ends early, interviewers have been instructed to do follow-up questions. They also give you time, if let's say you do end early, is that you can also ask them questions. So they usually open it like, do you have any questions for me? You should think about questions that you want to ask your interviewer. So don't go just into the interview and just answer their question, but it's really thoughtful, and I think it presents well if you also have some follow-up questions, maybe about the distinction tracks, maybe about their role in the interviewing process. Maybe they're a faculty member. We participate in MMI, so we're pre-health advisors. They have medical students that also interview. So you want to make sure that you have a list of questions that you want to ask the interviewers also. And then because it is timed, it is virtual, they will automatically move you out after 7 minutes and put you into the next room. And so then the process starts all over again. And so with the College of Medicine Tucson, there are 6 stations. They used to do 10. Again, that's a whole lot of work. So they really had to streamline it, one, because of the virtual and because of COVID. But if they do it back in person, my guess is that it'll go back to 10 stations. But this is what's happening this year. So they're looking for your self-awareness, your critical thinking, your communication, ethical decision-making, cultural competencies, and also anything specific about College of Medicine Tucson. Those distinction tracks are unique to the College of Medicine Tucson. So the stations are going to be, there's 6 scenarios at the College of Medicine Tucson. 2 of them are traditional, they're straight up questions, and then 4 are going to be discussion questions. And let me really emphasize, there are no right answers, but there's a whole bunch of wrong answers. And the reason why I say that is, you know, if it's an ethical decision and there's a critical issue and your immediate instinct is to judge the situation or go to a drastic measure, that's probably the wrong answer. They want you to think about it, think about both sides. If there's 2 sides to a situation, how is it viewed? How would you answer that question? Have you ever experienced something like that? But there are no right answers, but they want to know, what is your thought process? How did you come up with that answer? And then what examples did you use from your personal experience? And then how did it all tie into core competencies? So here again, I can't reiterate this enough because I've had this question in the MMIs, and it's interesting that applicants seem to assume that they know how they want to answer it, but many times they would come in and not even utilize the whole 7 minutes. And you should know how to answer this question, pull it all together. It's a no-brainer because you should know this, because this is really what they want to know is, you know, why do you want to be a physician? What in your academic personal life, you know, core competencies all tied in together, how would you answer this? And it can be asked many different ways. This is a sample of a discussion question. Discuss with the interviewer about a time when you had to make an important decision very quickly with little information on which to base your decision. And see in here, they're saying the attribute they're looking for is responsibility. It might bring in other areas of the attributes or core competencies, but this is one where they're wanting to know, okay, what is your responsibility? How did you come up with that answer? And also reassure you that everything related to the interview process is completely confidential. No one that interviews is on the admissions committee. So the information that is gathered together from the interview goes to the admissions committee. They make the ultimate decision. So these 6 stations, each interviewer is rating you, ranking you, making notes, and then it goes to the admissions committee. So like I said, if you bomb the first interview, you know, catch your breath, dust yourself off, gather your thoughts for the next question, and start new all over again. But everything is confidential and the interviewers are not part of the admissions committee. So what we're going to do today is we're going to do 1 traditional station and 2 discussion stations. And so for our first one, Well, just to give you an overview. So we have substantially cut down the time. One, so that we can leave time for questions and answers later, but also to make sure that we cover all three scenarios. So we're going to have the applicants, our ambassadors, they'll have 1 minute to read it. They'll have 5 minutes to answer the question, interact with the interviewer, which are going to be our pre-health advisors. And then at the end, generally speaking, in a regular MMI, you would have 1 minute to transition to another station. In this scenario, we're going to do the 1 minute reading. We'll have them interact for 5 minutes, and then we're going to go into a discussion with everybody if anybody has questions. So, and that's how we're going to do this. So, and it's going to be shortened quite a bit. And I will be your timer. And I will give them kind of a 1 minute warning at probably 4 minutes so that they can wrap it up. So with our first station, it's a traditional question. It's one interviewer and one applicant, and it's going to be Lauren Mosley. And then Kobe was actually our alum pre-health ambassador. He graduated last year, but thank you for coming back. And he's going to be our applicant. And so we are going to, oops, let me go back. All right, so what I need to do is, we're still going to share. So let me put on my timer, and we're looking at 4:32. All right, Kobe, you ready? Lauren, you ready?
I'm going to pretend like I don't know you, Kobe, when you walk in the room.
That's right. Oh, well, yeah, let me go ahead and make another note. Sometimes you will know the interviewer, and this is probably a big tip because I had this happen with me when I was an interviewer. A student that I'd worked with, I interviewed, and the student was actually overly familiar. You want to really keep it professional. Even if you know that person, they're your best friend, they're your teacher. You want to make sure that what you're presenting is unbiased and don't become too familiar. You still want to answer the question. You want to be professional. So thank you, Lauren, for mentioning that, because a lot of times you're going to run across someone who you know. You might even run across one of us as far as being in one of the stations. So, or a medical student. If someone graduated before you and they got into med school, they do have medical students part of the interview process. So don't become too familiar. So here we go. Kobe, you got 1 minute. All right, Kobe, you may now enter the room.
All right. Hello, everyone. And so in regards to my experiences, I'd say one of the most rewarding experience I've had throughout my whole undergraduate career is working and interacting with the student community. And so one big experience I had throughout a majority of my college career is through this program through the think tank called Supplemental Instruction. And so I was an SI leader for a huge chunk of my undergraduate career. And so through that, as an SI leader, we basically hold group study sessions where we facilitate group learning for historically difficult classes at the U of A. And so throughout my experiences, I'd say it really did give me a lot of, I guess, like self-awareness with, you know, how diverse and how different a lot of students are at the U of A. I feel like a lot of people aren't aware of just how many people have different learning styles, different cultural backgrounds here at the U of A. And so throughout my experience as an SI leader, I have come to realized and started to have that growth and passion for diversity in my own community that I am part of. And so I'm very fortunate enough to have had that experience with the Wildcat community through SI, through working with students, through working with professors throughout my college career, and throughout just being an SI leader. I've grown many and cultured and like developed many relationships with a lot of students from various backgrounds, socioeconomic backgrounds, cultures, learning styles, anything along those lines. I feel like through my experience, I started becoming more open-minded with how different a lot of students and a lot of individuals can be in a very diverse population, such as the Wildcat community and the Tucson city as a whole. And so in addition to being very self-aware and having that appreciation for diversity in the student community, I also have experience with the Tucson public community as well through a program called Life Step, which is a program through the Department of Psychology where college mentors are able to work with underprivileged and marginalized youth in Tucson. And so throughout my senior year, I was a mentor for a young Hispanic teen. And through that experience, I was able to learn a lot about what it is like to be in a very underserved community like himself and his family. He does go through a lot of emotional and behavioral problems and issues that I had the privilege to work with. I was able to kind of get him going in terms of academics, social skills, and being just a confident individual in general, despite being in a marginalized community in Tucson. And so throughout my experiences through Life Step with my mentee and also working with various different students through supplemental instruction at the U of A, I strongly am confident enough that I have developed the cultural competency required to be a doctor in the future. And with the growing diverse population in the United States, it's only going to get more and more diverse from here on out. I do believe that there is a high demand in doctors that have that cultural competency. And I do believe that I can have that strong impact and that strong influence in the future generation of doctors through my experience with the diverse population here at the U of A and in the Tucson community. And so through that, I really feel like my leadership skills through both programs can help develop me into being the most, I guess, social and culturally competent doctor I can be to help kind of just communicate and just contribute to whichever community that I end up being in the future. And so I strongly believe that through my experience, I have that passion for diversity for whichever patients walk through my door in the future.
All right. Thank you so much, Kobe. Do you have anything else you'd like to add before we wrap up?
As of right now, no.
Okay. Are we at time, Josie?
You are right now. So
Awesome.
interview is ended. Let me go ahead and go back and share my screen. So let's talk about this, right? I mean, I think if you're in the middle of interviewing and you think, oh, you know, that was just 5 minutes. 7 minutes, it seems like a lifetime. I don't know, Kobe, how did you feel about the timing?
I felt like it was pretty quick, but I've had experience with the 7-minute timing and it can feel like a lifetime with those extra 2 minutes for sure.
How did you prepare for this question?
For this one, I kind of just wanted to focus on the core competencies you mentioned in a previous slide, such as like service orientation, social skills, cultural competency. I feel like having that background and knowing what you excel at in regards to those competencies really helped me kind of develop my answer to that question.
And Lauren, how did you feel that he answered that question?
Yeah, I mean, I got the idea that you do have different experiences working with diverse people of different types of diversity, right? Like you spoke to that. I think what I wanted from you, Kobe, is something about clinical experience, right? because there's a lot of different jobs you can do where you can be helpful in the community and connect with people of different backgrounds and stuff like that. But being a doctor has very specific things like people being in pain, people hurting, you not being able to solve their problems, them throwing up on you and things like that. So like, I would want to hear, you know, why doctor specifically here? What experiences did you have that you're like, oh, okay, like I work really well with patients specifically versus just kind of diverse people specifically. So I think maybe editing it a little bit, you could totally still talk about SI and with your program or your mentor, but if you kind of like also maybe added a part where you're like, and then there's this aspect too, and maybe kind of working in more story, more narrative to it, maybe talking about, maybe you could cut out the SI part and just talk about the time you're a mentor and talk about like a specific time with your mentee and where, you know, you really empathize with him on something, or you had a realization about how maybe you were more privileged than he was because you didn't have to deal with something that he did or something
So
like that.
I think that's good, you know, and again, you know, you're going to be interviewed by different people and they're all coming to the table looking for maybe something a little different. But it's good to cover all your bases. But yeah, answering the question, why you want to be a doctor, integrating that clinical piece probably will be very important.
And I like that you broke things down as well. Like you didn't just jump in and say, oh, you know, I worked in SI at Think Tank. Like you explained what it was. You explained what first step was. You explained all of that.
So they were looking for self-awareness, communication, and empathy, right? And all that came across on this particular one. So let's set it up for the next one. Oops. There we go. All right. So I know Nettie was having technical difficulties. Nettie, you okay?
I'm here, yeah.
Yay. All right. And then Lauren, our ambassador, Lauren, this particular station is a discussion question. And so if we are ready, let me go ahead. We're going to be timing. So here comes the question, Lauren. Okay, let me unshare the screen. And go ahead and start. You may now enter the room, Lauren.
Welcome, Lauren. Do you understand the prompt or have any questions?
Yes, I understand the prompt. So hello, my name is Lauren. Also, I apologize for any background noise. I'm outside. But I don't want to assume anything based on the prompt, but to me, it depends on how the friend is handling the rejection. I think that depending on the person, they can handle it. You know, obviously it's news that nobody wants to receive, but someone might throw themselves into the next thing and think how they could change or alter their application. And other people might be considering giving up. And so, of course, it's difficult news to hear, but if they are considering giving up or they are handling it badly, then I would want to be the best support system that I can be for them. And I think that this looks different for everyone, but considering that this is a friend of a friend sort of situation, and I might not know them as well, I think that a safe way to go about it would be just being there and listening to them so that they could feel heard and comfortable sharing how they feel. I think that's the best thing that you can do, and that's what I would want to hear if I was in their shoes. And I think it'd be best to stay neutral and let them talk, because I think it'd be difficult to throw all this positivity at somebody who just received bad news. But I also think it would be especially difficult if I were in their shoes to hear someone say, oh, well, next time you should do this, or I did this and you didn't, so you should change this or do that, and that's why you didn't get in, because then they might blame themselves. And it's okay to not want to make those changes right away, because I think it takes time to grieve a rejection. And I think that if the roles were reversed and I was rejected and my friend got in, I would just want them to listen to me and support me. And when I'm ready, I would come to them and maybe ask for advice and changes that I could make to my resume and my application. But I also think that it would be really important to acknowledge that it's really amazing to get accepted, and that I can still be really happy for myself, even while grieving for my friend and with my friend. And I would hope that they could still be excited for me, just as I would be for them if I were in their shoes. And then I think that the most important thing to tell them is that I'm so proud of them for applying and being able to apply and even meeting the PA program prerequisites and criteria, because that alone is just challenging. And as someone who's gone through the process of applying, it's very emotionally taxing and time consuming and challenging overall. And I think people forget, and they experience maybe imposter syndrome, or they, only dwell on the things that they've maybe not done as well on, when they don't see how far that they've come. And to just be able to apply, even though that they weren't accepted this time, is still
1 minute.
really awesome. And there's still more opportunities in the future to apply if they think that that's the best decision for them, and they can work towards that. But if it were me and I was in their shoes, I would just want to be supported by genuine people who care about me. And sometimes I think that everybody just really needs to hear that they deserve to be proud of themselves.
Great. I know we have less than a minute, but I'm going to throw this out there. What if your friend says they feel like a huge disappointment, they have no reason to live, if PA school was their one shot? How would you react to that?
Again, like I would say, like I would just try and reason with them and say that I can understand feeling that way, but I would try and remind them of all the great things that they've accomplished and how far that they've come. And maybe when they're ready, try and steer them in a more positive direction, or maybe to.
And the interview is over. So let's talk about this. So here's the thing about this one. And I think, definitely communication, excellent example of communication, empathy skills, and decision-making. But a lot of times in a scenario like this, don't feel that you're the only one that has to answer. If a person is really depressed, and maybe it's a word choice when you said doesn't really want to go on. If you hear those kind of keywords, you want to ask and really bring in professionals and suggest, maybe you're so depressed, you need counseling, right? Because you shouldn't have to have all the answers, and you're probably not trained to do that. The other thing I always say is, hey, send them back to us, because we're used to having people who don't get in, and it's a safe environment. So you definitely want to make sure that you also provide other resources, because you're not, even as a physician, you're working as a team, right? So you have social workers, you have counselors, you have techs. So, always do refer when you can, if you feel that you can't handle it. But I think you definitely showed empathy skills. So Nettie, what's your take as you were interviewing?
Yeah, I thought that was a really great response. And I had worked with some mock MMIs before. So I think, Lauren, your response is really great. How you began by saying you don't want to make assumptions on the friend of a friend. That's really important and mature of you. How you didn't want to give advice or tell them what to do just because you got in. Because, right, you're also not an expert yet. You are not a PA yet. So being aware of that and just listening to them, being a good friend. And it sounds like you would be really aware in the conversation as well in where it's going. And like Josie said, being aware if you need to pull in resources as necessary. So I think that sounded really good.
How did you feel, Lauren?
I felt good. I mean, it's kind of a heavier question. And sometimes it can be difficult to kind of keep going and elaborate, but I feel like there was a lot to say with this one. So I felt pretty good about it.
Yeah, you did well. And so now we move on to our last scenario. So this one is with Ethan and Anam. And so this is also a discussion question. And so let's go ahead and start the timer. So 4:50. Here is the question, Anam. Okay, you may now enter the room.
Hello, welcome. I'm Ethan. I'm a pre-health advisor. Do you have any questions on the prompt?
I do not. It's really nice to meet you, Ethan. I'm Anam. So I'm going to begin by answering the prompt. I think this question, just based on how it is, as a doctor, there's just so many scopes that you look at to assess a patient, being their age, the health status, cognitive ability, any other learning disabilities that they have, as well as gender in terms of their health, because each gender has like their own health consequences or outcomes to it based on a disease. But based on the limited amount of information that I have and the little information I have about ventilators at this current point, I think the percentage of people who are on ventilators have a higher chance of surviving are people who are below the age or of a younger age like cohort than people who are of older cohort of age. So based on just that limited amount of detail from the question, I would choose the 22-year-old to get the ventilator just based on life expectancy. But other than that, if you could let me know if there's any other outcomes I should look for or have information of, then my question or my answer can change based on that.
Oh, great. Awesome. Thank you. Great response. And it seems like you have a good principle that you're operating on there in that situation, that whoever is most likely to survive the experience of a ventilator is the one that you would choose. How would the situation change if, let's imagine the 56-year-old patient is a sitting state senator, and the 22-year-old, he just works at a local bar. They're both in great health. Would that affect your decision at all?
No, it would not. As a doctor, I'm not really looking at their personal life or what status or what their job is. I'm looking at them as a patient and that they're in need of my help. And if there's only one ventilator available, again, I will look at who's in more critical condition, who has a more life expectancy. So based on that, I can't necessarily say who I would give the ventilator to. Only from the age outcome of a higher expectancy, I would still give it to the 26-year-old or the younger person in that situation.
Great. What about if the 56-year-old being a state senator, you come to find out that the 22-year-old is a recovering addict with multiple underlying health conditions? Does that affect your decision?
And can I ask a question? Does the 56-year-old have any other underlying health conditions that I need to know about?
They do not. They're in great health. Okay,
so based on that, I think mentioning that they were a recovering drug addict, again, they're a patient of mine. And if they do have any underlying health effects due to their drug activity, it's not necessarily I'm choosing the 56-year-old because they're not a drug addict or they're not a recovering drug addict. It's just because the 26-year-old or the younger person is not in critical, it's not healthier than the 56-year-old, and using the ventilator won't benefit them as much than using it on the 56-year-old. So in that situation, I would give the ventilator to the 56-year-old because they have a higher chance of surviving if there's only one ventilator available.
1 minute.
Great. So last one. What if you're in this situation and one of the patients got the COVID vaccine, let's imagine the 56-year-old got their COVID vaccine and the 22-year-old did not get the COVID vaccine. Would that change your decision?
It would not change my decision just because the COVID vaccine is fairly new and we don't know all of the effects of it. We know the limited effects is to prevent COVID, but in that situation, the ventilator still, even if a 56-year-old has the vaccine, besides them being in a healthier age, healthier lifestyle compared to the 26-year-old, the vaccine and the ventilator are shown to work more effectively on the younger age cohorts. But in that situation, since the 26-year-old is a recovering drug addict and has underlying health issues because of it, again, in that situation, I would give it to the 56-year-old because they have a higher chance of surviving using the ventilator than compared to the younger person.
Your interview has ended. Good job.
Great,
Ethan,
great timing.
You want to give some feedback on what your impression was as you were interviewing Anam?
Yeah, I thought you did great. I thought that you did a nice job sticking to your principles, right? And I think, with some of these, so many of these questions don't have a right answer. And so I think, picking a reasonable and logical principle and then reasoning through it out loud is kind of what folks are looking for. And so I think you did a really nice job of sticking to that, thinking through the situation out loud and kind of rolling with the new information as it came in, and thinking on your feet in that way. I think you did great.
Anam, how did you feel?
I definitely felt nervous in that question. I think when it comes to a question that makes you decide between having one patient live and one patient die, in a sense, is stressful. But at the same time, that is a decision a lot of people in the health profession need to make. So yeah, I think everybody needs to go through this experience once at least, just to see how they act in that situation.
So really, the bottom line on this is how you answer it. Again, there are no right answers, but how do you support what you're answering? And if you had experience, but basically this particular discussion question was really looking at communication, your empathy skills, decision making, and what I heard Anam talking about was really being fair and equal, and some of these other exterior things that were going on, that she still maintained that same level of fairness. And so again, backing up, there's no right answer, but how you answer it and why you answered it that way is what that interviewer and admissions committee is looking for. So that's a wrap up of our third mock MMI question. So we're down to now just the tips. So again, this will be on our website, but there's some tips about your background, how you dress, your internet connection. I'll use an example. Ethan recently had a student approach him saying, where they couldn't really do an interview through Zoom because it wasn't private enough, it wasn't professional enough. So we actually utilized one of our offices to do that. So make sure that the area that you're going to interview, and I know for today's purposes, we have people outside, but you want it professional, you want it clean, no distractions. Make sure the lighting is right. Try it before you do it so that you're not washed out if there's like lighting that's too strong. Choose a location that's quiet where you're not going to have any interruptions. So these are just some of the tips. And again, this is coming from the College of Medicine, Tucson. And here's their contact information. So Dr. Parikh, Emily Leva, Mark Romero, Megan Sorensen actually runs the MMIs, and then Mona Lopez with the PMAP program. And there's their contact information. Other information that they provided, and actually they provided us with their PowerPoint that they actually used for this first mock MMI that included some of the logistics, like how to log on and that. So if you're interested in that and you want to make an appointment with us, we can probably cover that individually. But other troubleshooting things as far as your camera, if your audio is not working, and this is for those applicants that will be interviewing with College of Medicine Tucson, this is their suggestions. And then I just really want to thank the pre-health profession advisors and the ambassadors. We have 11 ambassadors, and Kobe, thank you for coming back to join us. But at this point, I want to open it up to any questions that any of the guests who attended today might have for any of our advisors, myself, or the ambassadors. Do we have anything in the chat, guys?
I'm answering in the chat. There was a question that Hope asked about asynchronous interviews. You know, which I imagine is like a pre-recorded interview, and there's a variety of things that are popping up that are new.
Oh,
that
like the Casper, right? Some of those are the pre-recorded. So depending on the health profession that you're applying to or the school, if they utilize, and I think Vita, is it Vita? That's the other one for med schools. So I would just follow their direction. If it's you probably want to do all this, especially if you're recording it. Keep a clean background, keep it professional, be articulate, answer the question, utilize your personal experience, tie it into core competencies, and I think you'll be good to go. And, you know, I don't know, is it like a one-shot deal or whether or not you can re-record? I'm not too familiar with that. But I would check it out. Definitely. They give you, usually, you know, the schools, again, they don't interview everybody. So when they invite you for an interview, they'll send you, like I know the College of Medicine Tucson will send you MMI links, send you information that you need to know to prepare you. They're not tricking you. They want to know that the person who applied, who has all this great experience, that they've invited you for an interview is actually the person that wants to go to their school. And then, you know, then they make their selection from there. But you've made it to this point and you should be really encouraged that you got a shot at getting in. If you don't get an interview, you don't get in. I mean, that's just plain and simple. Any other questions in the chat or anything else anybody wants to ask?
I just wanted to say, because I did the Casper recently. And so I did it's called a snapshot portion. And they give you all this time to set up and see what you're going to look like. And they give you practice questions for you to practice kind of recording, and which I found really beneficial because I didn't realize I looked the way I did sometimes when I was answering questions. And so a lot of them have programs like that where it lets you practice as many times as you want before taking it. But other than that, you know, it gives you the question, and then just like this, you have a certain amount of time to look at it, it disappears, and then you just get one shot to record it, and then it just stops when your time runs out.
Lauren, thank you for sharing that. That's very insightful and from an applicant's perspective. But again, you know, and there's, you know, we all have mannerisms that might come across that we don't even know might be irritating, right? So, you know, if you get to practice, that's why practicing is so important. But it is hard to do like a mock MMI on your own if you don't, you know, because you have to coordinate all these people. But definitely you want to practice your interviewing. If you're here at the University of Arizona, the engagement office, the Career Center does that also, works with students to prepare for interviews. So, and definitely you can meet with us and we can talk with you and, you know, in your particular scenario and talk about what you're bringing to the table that you take for granted. Like, wow, you know, that experience with the Z Mansion that you're doing, you might want to talk about that, working with the homeless and working with the underserved and lack of access. So definitely, you know, we are available for any appointments to work with you. Feel free to utilize our resources. Our next workshop will be on the Mcat Resources. You don't necessarily need to do a prep course. Students have done well with and without prep courses, and they are very expensive. So Ethan will be presenting that, and he will cover where are these different resources. AAMC, if you're not familiar, utilize that website because they have a lot of good information. Any last minute questions or anything the advisors want to note or any of the ambassadors want to note before we close this session?
There is a question in the chat that I think is a really good one. If you could address that, Josie. They
Sure.
ask, how do you draw the line between practicing versus sounding rehearsed?
Let me tell you, they know. It's like, you know, when you're filling out secondary applications and you cut and paste, they kind of know. These interviewers are trained, and they also, just like us, I mean, if you're coming across as, robotic or already well practiced, because they want to feel that passion that comes across, right? You want to convince this person that you are a good fit for that med school and that you've done this because you are passionate about it. If you come across very systematic and very robotic, I think you won't be able to share that passion. And so they want to see that. They want to know what put you on fire. Why are you running to the fire, especially during COVID? We have students who still want to be doctors and they're running to the fire. And what makes you want to do this? And you're going to have to convince that interviewer. And so if you do practice and you feel that you're being very robotic, or you're feeling like you're systematically answering these questions, look yourself in the mirror and practice with someone, that may know you, that might be able to encourage you to maybe you need to be a little bit more animated or come across a little bit more passionate. And I think for those that might be a little bit more introverted, might have it a little difficult, but you've got to be able to do that to convince them so you can get into that class of 120.
Shout out to Ashley for all these thoughtful questions.
Yeah, thanks, Ashley. Is that Ashley Jones?
Yes, it is.
Good job, Ashley. Any other questions?
Rohan posted one in the chat. So he said, I believe interview scores are given out of 10 points for some schools. So what score would Kobe, Lauren, and Anam receive based on their answers? I don't know if anyone wants to chime in. I don't know if we want to.
Well, and I think it's fair, so, all right, who is Kobe's interviewer? Lauren?
Oh, you muted. We all muted for some reason. You muted for a second.
Oh, I didn't mean to. Well, what score would you have given him?
So I feel bad because I have only done a few MMIs and they've all been mock MMIs. And it's really hard because I feel like I definitely did want a little bit more on the specific physician side, but I think you did a great job of speaking to your experiences. I'd maybe go with a 7.
I would think if you integrated that clinical experience, it would definitely be a 9 or 10.
Yeah. I think you structured it well. I didn't ever feel like you were rambling. I do think it was good. I mean, I would love to talk to you more about it, for sure. And I know Josie would too, to just kind of help get this a little bit more polished up. But yeah, I don't think you did poorly. I wouldn't have given you a negative score for sure. Anything below a 5, I wouldn't do.
And Nettie, what would you have given?
I'm going to be harsh and picky only because, so this is a practice. But Lauren, just based on, let's say, background and attire, everyone is the same. But if it was just on your answer, I would say a 9. But then all things considered, being outside, you of course wouldn't want to do that with a real MMI, things like that. So yeah, I would say a 9 for the answer. Josie, what do you think?
I would agree. Again, remember they're interviewing 650. Let me tell you, not everybody gets 8s, 9s, or 10s. And so mostly though, and if they've never practiced, you see a lot of 5s, you see a lot of 6s, but to really hit it out of the ballpark, answer the question, tie it into a core competency, tie it into a personal experience, and then it will hit it out of the ballpark. And then Ethan, what would you give Anam?
Yeah, I probably, kind of in the 8 range. It would depend, right? I mean, when you're scoring these kinds of things at an interview, you've got a series of competencies you're looking at, and you're using a rubric. And so, it would kind of depend on what that rubric looked like. I mean, I think there are, ways that the answer could be improved, might be, I think something she mentioned in her comment, Anam, was how hard of a decision that would be. And so maybe talking about that a little bit, maybe pulling in a personal experience to relate it back to where an ethical decision was made. So maybe in the 8 range, but again, it would depend on what competencies you're looking at specifically and whether you can give points for that. So remember that, right, when these things are scored, they're scored in this very specific and odd way, unique to the medical school. And they're having you look at particular competencies behind the scenes that they don't necessarily share with you. And so yeah.
Well, anyway. and so let me just kind of tie this all in together. So evaluators, as we are trained, right? One is consistency. So if it turns out that Ethan or someone else is a stronger, it's kind of like having an instructor that may not give an A, but still in that curve, you still have those excellent students. Or you have someone who's a little bit more lenient in rating, but it's consistent. So every person that each one of us would rate in a round of MMIs would be consistent. And that would all go to the admissions committee. So basically they're looking at all components and that they're consistent. And so this is the other thing is, you've got to be comfortable with your answer, right? And you want to do the best possible interview with that individual, no matter who it is. You might get a tough interviewer. You might get a lenient interviewer. You probably get a mix of everybody. So ultimately, it all pans out, right? And it's not all on the interview. It's not all on the secondary. They look at every component, what you bring to the table. So just know again that, and I'll leave you with this thought, is you got an interview. So you got a shot at getting in. And if you're a reapplicant, don't feel bad, seriously, but make sure that your application the following year has what you've done differently to fill in the blanks. Maybe it was you needed stronger letters, maybe you need more clinical experience. And that's where you want to come in and talk to us so that, we make you or talk to you about being the most competitive applicant you can be at this time. So with that in mind, we want to thank you for coming. Anything left in the chat?
One more, Ashley has one more. So you mentioned there's resources at the U of A for students. Are those resources also for alumni, or where could alumni look for resources like this?
Career Services or the engagement office, I believe they charge you. We will work with you. You don't have to charge it. We don't charge you. You can be gone 10 years and come back. I would say, the foundation, the Alumni Association, they do like career mentoring and things like that. No doubt there's health professionals in there. So I would utilize them, but also utilize us. And so, as an alum, you can use us as often as possible you want. So come and see us. But thank you for coming today and staying a little bit over. Have a wonderful rest of the afternoon.